ਬਰੈਂਪਟਨ ਦੇ ਮੇਅਰ ਪੈਟਰਿਕ ਬਰਾਊਨ ਵੀ ਹੁਣ ਮੰਗ ਕਰਨ ਲੱਗ ਪਏ ਹੈ ਕਿ ਜਲਦੀ ਤੋਂ ਜਲਦੀ ਬਰੈਂਪਟਨ ਨੂੰ ਵੀ ਰੈੱਡ ਜ਼ੋਨ 'ਚ ਲਿਆਂਦਾ ਜਾਵੇ। ਉਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਇਹ ਠੀਕ ਨਹੀਂ ਲੱਗਦਾ ਕਿ ਮਿਸਾਗਾ ਜਾਂ ਓਕਵਿਲ ਜਾਂ ਵੌਨ ਜਾਂ ਮਾਰਖਮ ਜਾਂ ਹੋਰ ਬਾਕੀ ਸਾਰੇ ਸ਼ਹਿਰ ਰੈੱਡ ਜ਼ੋਨ 'ਚ ਹੋਣ ਤੇ ਬਰੈਂਪਟਨ ਇਕੱਲਾ ਫਿਰ ਗ੍ਰੇ ਜ਼ੋਨ 'ਚ ਕਿਉਂ ਹੋਵੇ। ਬਰੈਂਪਟਨ ਦਾ ਜਿਹੜਾ ਬਿਜ਼ਨਸ ਹੈ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਉਹ ਸਫਰ ਕਰਦਾ ਹੈ ਇਸ ਕਾਰਨ ਕਰਕੇ। तो ਉਹਦੇ ਬਾਰੇ ਅਸੀਂ ਉਹਨਾਂ ਨਾਲ ਗੱਲਬਾਤ ਕਰਨ ਜਾ ਰਹੇ ਹਾਂ। ਔਰ ਦੂਸਰਾ ਬਰੈਂਪਟਨ ਕਿੰਨਾ ਕੁ ਪ੍ਰਿਪੇਅਰ ਹੈ ਜਦੋਂ ਹੁਣ ਲਾਰਜ ਨੰਬਰ ਆਫ ਵੈਕਸੀਨਸ ਇੱਥੇ ਆਉਣਗੇ ਉਹਦੇ ਬਾਰੇ ਵੀ ਉਹਨਾਂ ਤੋਂ ਜਾਣਨਾ ਚਾਹਾਂਗੇ। तो ਅਸੀਂ ਵੈਲਕਮ ਕਰਦੇ ਹਾਂ ਮੇਅਰ ਪੈਟਰਿਕ ਬਰਾਊਨ ਦਾ।
Rajinder, always a pleasure to be on your show.
Thank you so much. So Mayor Brown, Monicromby is demanding very strongly for the last couple of weeks. Now you have also joined her. So what are the logics? What are the reasons which can be supporting your demand?
So the Region Appeal Council 2 weeks ago passed a motion asking for Peel to be reopened. It was passed unanimously by Caledon, Brampton and Mississauga. And now more recently, the Mississauga and Brampton councils have also passed motions asking to be reopened. You can't divide up the GTA. The reality is we have Vaughan open, Oakville open, Markham open, and we look at the cell phone data, Rajinder. We have access to it as mayors to see where people are moving. And right now you're seeing people in Scarborough go to the open stores in Markham, in Mississauga, they're going to Halton, in Brampton, they're going to Vaughan, in Caledon, they're going to Orangeville. People are moving to where the restaurants and the stores are open. The GTA is too interconnected. You can't divide it. And frankly, our businesses have been locked down long enough. And if I look at the data, people said it was about healthcare capacity. Our healthcare capacity is the best it's been in 6 months.
But our medical experts are telling us that we are on the verge of a third wave also. So are you sure? Do you think that we are ready for opening in coming weeks now?
Our medical expert in Peel has not said we're on the verge of a third wave. That's not something that has come from him. And my contention remains the same, that you can't divide up the GTA. The notion that people will stay in their own neighborhoods and they don't move around is naive. You need to have consistent policy around the GTA. And I have to say we've now vaccinated all our long-term care homes. We're in the process of vaccinating those over 80. I think it's time to start looking at economic recovery as we roll out these vaccines.
Okay. You're talking about vaccines, Mayor. We are having AstraZeneca consignment right now, but there's lots of confusion around that. We were told that it is not good for people above 65 or 70. That's why it was decided that they will be put on people between 60 to 64. There were pilot projects going on in couple of cities. You demanded that Peel should be, or particularly Brampton should be included in that. So we are expecting lots of consignments from Pfizer also. But talking about this AstraZeneca vaccines, so many confusions going around this vaccine.
Yeah, so the Government of Canada has an advisory panel that looks at the health and safety of these vaccines, and that panel has recommended that it is better to use the vaccine for those under 65. And this is a panel comprised of physicians and scientists. I'm not a physician or a scientist, and I trust their recommendations. The Ontario government has said they trust their recommendations, and they're going to be using the AstraZeneca vaccine for those under 65.
Okay, and family physicians have been allowed to use these vaccines?
So right now the government of Ontario is doing a pilot project in pharmacies and family doctor offices in only certain parts of the province. And they've picked Peel Region as one of the areas to test the AstraZeneca vaccine delivery through primary care providers, which is family doctor offices. There's going to be 8 locations in Peel Region where you can get vaccines through primary care providers.
Okay, we spoke to a couple of people in last couple of days, and those people are quite confused. Earlier they were given date between 30 days for the second dose. Now they have been extended to June or July. So Pfizer company's experts are saying that we recommend that second dose should be injected between 21 to 20 days, at the most 30 days. But here we are giving them dates for 3 to 4 months. Again, you are not a medical expert, I am not either, but this is another confusion in the public.
Yeah, so once again, this was a recommendation from Health Canada, who are working with these companies. And because there's a shortage of vaccines, Canada doesn't have these vaccines right now. We're still waiting for them to arrive. This is one of the things they're doing to help save lives. The more people who get the first vaccine, the better protected we're all going to be. And so Health Canada made a decision based on the consultation with the drug companies like Pfizer and with medical experts and scientists that they thought this would be the best way to protect lives.
Okay. And last time when we spoke, you said that Brampton is all set to put these vaccines as early as possible. Peel took lead when they started putting injection above 80 years of people. Now, how much we are prepared, because now large number of consignments will be coming to Brampton. How much well Brampton is prepared now?
So we're very well prepared. We just don't have the vaccines. We're waiting for Canada to get the vaccines. So right now, we could do 70 times more in Peel region, 70 times more than the vaccines, the supply we get each day. So we just need more vaccines. You know, we could do 70,000 vaccines a day, even more in Peel region if we had the vaccines. So hopefully the government of Canada will get some of these vaccines because we are eager to get them in people's arms. We're eager to protect our residents.
Okay. Amazon authorities are not happy with the decision of Peel Health that their operation should be shut down for at least 2 weeks because of the rate we are getting there, infections, a large number of infections we are getting there. You have very strongly supported this, that yes, health is the top priority for us. They are now asking for an appeal.
I support Public Health's decision to close down Amazon for 14 days. No corporation, no matter how big they are, no matter how influential they are, is more important than the health and safety of our residents. And in the case of this Amazon facility, there's been 600 plus infections. The rate of infections in the Amazon plant is going up. It's going down in the rest of the community. So frankly, if we allowed this to go unabated, it would diminish our ability to reopen. And so we need to get this under control. But I think this is also a reminder that we really need to vaccinate our essential workers. I need vaccines so we can vaccinate our essential workers. That's where the outbreaks have been. You know, the food processing plants, the transportation logistics companies, we need vaccines to protect these unsung pandemic heroes.
Okay, thank you so much, Mayor. Canada has suffered a lot. We have gone through very tough, very challenging time because of this pandemic. But now we have a ray of hope now. We are expecting large number of vaccines as early as possible. We are all well prepared for that. Weather will be good in coming days. So what do you have to say at the end?
Well, I'm growing impatient. You know, everyone keeps on saying the vaccines are going to come and come. Right now, Canada is 54th on the list in terms of vaccine supply per capita. We need those vaccines yesterday. We need those vaccines, and so I'm hearing that there's going to be vaccines coming. But until I see them, until I see we got the vaccinators ready, we got the mass vaccination centers ready, but they're empty. They're waiting for vaccines. So. I'll believe it when I see it. I want to see those vaccines.
Okay, thank you, Mayor. We'll talk soon again. And as you are quite hopeful, let's keep working hard, all of us together, and let's get out of this pandemic as early as possible. Our neighboring country, America, is doing wonderful under the new leadership. I'm sure we will be out of this pandemic soon, working all together. Thank you so much, Mayor.
I hope so.
तो ਇਹ ਸੀ ਜੀ ਸਾਡੀ ਗੱਲਬਾਤ ਬਰੈਂਪਟਨ ਦੇ ਮੇਅਰ ਪੈਟਰਿਕ ਬਰਾਊਨ ਦੇ ਨਾਲ, ਜਿਨ੍ਹਾਂ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਐਸਟਰਾਜ਼ੈਨੇਕਾ ਦਾ ਜਿਹੜਾ ਇਹ ਵੈਕਸੀਨ ਹੈ ਇਹਦੇ ਬਾਰੇ ਬੜੇ ਸਵਾਲ ਉੱਠ ਰਹੇ ਆ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਮੈਂ ਕੋਈ ਮੈਡੀਕਲ ਐਕਸਪਰਟ ਨਹੀਂ ਹਾਂ, ਪਰ ਜਿਸ ਤਰ੍ਹਾਂ ਕਿ ਹੁਣ ਫੈਮਿਲੀ ਡਾਕਟਰਸ ਨੂੰ, ਫੈਮਿਲੀ ਫਿਜ਼ੀਸ਼ੀਅਨਸ ਨੂੰ ਅਲਾਓ ਕੀਤਾ ਗਿਆ ਹੈ ਕਿ ਉਹ 60 ਤੋਂ 64 ਸਾਲ ਦੇ ਲੋਕਾਂ ਨੂੰ ਉਹ ਵੈਕਸੀਨ ਲਗਾ ਸਕਦੇ ਹੈ। ਤਾਂ ਉਹ ਵੇਟ ਕਰੋ, ਜਿਨ੍ਹਾਂ ਨੂੰ ਕਾਲ ਆਏਗੀ ਉਹੀ ਲੋਕ ਉੱਥੇ ਜਾਣ। ਔਰ ਦੂਸਰਾ ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਅਸੀਂ ਬੇਸਬਰੀ ਨਾਲ ਇੰਤਜ਼ਾਰ ਕਰ ਰਹੇ ਹਾਂ ਕਿ ਕਦੋਂ ਇਹ ਵੈਕਸੀਨ ਆਉਣ। ਆਲਰੇਡੀ 80 ਸਾਲ ਤੋਂ ਉੱਪਰ ਦੇ ਲੋਕਾਂ ਨੂੰ ਵੈਕਸੀਨ ਲੱਗ ਰਿਹਾ ਹੈ ਬਰੈਂਪਟਨ ਦੇ ਵਿੱਚ, ਪਰ ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਜਿੰਨੀ ਜਲਦੀ ਵੈਕਸੀਨ ਇੱਥੇ ਪਹੁੰਚਣਗੇ ਅਸੀਂ ਬਿਲਕੁਲ ਤਿਆਰ ਹਾਂ। ਤੀਸਰਾ ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਐਮਾਜ਼ੋਨ ਦੀ ਜਿਹੜੀ ਫੈਸਿਲਿਟੀ ਬੰਦ ਕੀਤੀ ਗਈ ਹੈ ਬਰੈਂਪਟਨ ਦੇ ਵਿੱਚ, ਉਹਦਾ ਕਾਰਨ ਇਹੀ ਹੈ ਕਿ ਉੱਥੇ ਬੜੀ ਵੱਡੀ ਗਿਣਤੀ ਵਿੱਚ ਜਿਹੜੀ ਇਨਫੈਕਸ਼ਨ ਹੈ ਉਹ ਫੈਲ ਰਹੀ ਸੀ। ਔਰ ਉਹਨਾਂ ਨੇ ਇਹ ਵੀ ਮੰਗ ਕੀਤੀ ਹੈ ਕਿ ਬਰੈਂਪਟਨ ਦੇ ਵਿੱਚ ਕਿਉਂਕਿ ਫਰੰਟ ਲਾਈਨ ਵਰਕਰ ਰਹਿੰਦੇ ਆ, ਟਰੱਕ ਡਰਾਈਵਰ ਰਹਿੰਦੇ ਆ, ਫੂਡ ਚੇਨਸ ਦੇ ਨਾਲ ਕੰਮ ਕਰਨ ਵਾਲੇ ਲੋਕ ਹੈ, ਡਿਲੀਵਰੀਆਂ ਵਾਲੇ ਲੋਕ ਹੈ, ਤੇ ਇਹਨਾਂ ਨੂੰ ਪਹਿਲ ਦੇ ਆਧਾਰ ਦੇ ਉੱਤੇ ਵੈਕਸੀਨ ਲਗਾਏ ਜਾਣ। ਇਹ ਸੀ ਸਾਡੀ ਅੱਜ ਦੀ ਗੱਲਬਾਤ ਪੈਟਰਿਕ ਬਰਾਊਨ ਦੇ ਨਾਲ।